Hello and welcome to Askimo TV. I'm talking today to Dr. Norman Briffa. Dr. Briffa is a consultant cardiac surgeon at the Northern General Hospital in Sheffield and senior lecturer at the University of Sheffield in the UK. Hi, Dr. Briffa, how are you?
I'm very well, thank you.
Dr. Briffa, let's talk today about heart valve disease. And I'd like to start off with, what are heart valves?
Heart valves are structures inside the heart that maintain unimpeded flow of the blood and make sure that they ensure that blood travels in one direction, that blood doesn't go back within the heart.
What causes heart valve disease and who would be at risk of getting this condition?
There are several causes of heart valve disease, and it depends where you are in the world. But certainly in Europe and the United States, the commonest cause of heart valve disease are degenerative causes associated with age, whereas in Asia and parts of Africa, the commonest cause of heart valve disease, it tends to affect the young, and it's rheumatic fever.
What are some of the signs and symptoms that may indicate that a person has a problem?
The commonest symptom is shortness of breath and swelling of your usually of your ankles. But shortness of breath is a sure symptom that you may be developing a problem with one of your heart valves.
How is heart valve disease diagnosed?
Usually you take a history, because there are certain features of the breathlessness that may indicate that it's a problem of the heart rather than a problem, say, of the lungs. But the main test that you can diagnose heart valve disease is an echocardiogram or an ultrasound scan of the heart.
And once you diagnose that it is indeed heart valve disease, how would you treat a person? Is surgery the only option, or are there other options?
Once you develop symptoms, yes, you need treatment of the valve. You need some intervention on the valve, and the commonest is surgery. But there are certain types of heart valve disease that could be treated with either stretching of the valve, or more recently there are types of treatments that involve actually placing a new valve within the diseased valve, and that's done through a small groin incision, and it's done on a wire with a light anesthetic. So in certain conditions it is possible to avoid surgery, an open heart surgery, that is.
If you were going to perform surgery, what would the surgery involve?
The surgery would involve, a sternotomy, which is a full splitting of the sternum, placing the heart on a heart-lung machine, opening the relevant chamber of the heart, most times you have to replace the valve, that is, remove the diseased valve and put in a new valve. In certain types of heart valve disease, you could actually repair the valve, because in certain situations it is better to keep your own repaired valve rather than have an artificial valve placed inside the heart.
And what is the prognosis for recovery after surgery?
Can you say that again, please?
What is the prognosis for recovery after surgery?
It's very good. Most patients do very well. It takes about 6 to 8 weeks to recover, but once you recover, you can get back to full fitness.
And just to end off, what are the complications that can occur if heart valve disease is left untreated?
Well, death eventually. You develop heart failure, you become more and more breathless, and then you reach a point where it's too late to receive any treatment, unfortunately. So heart valve disease is progressive,
Thank you, Dr. Briffa. Thank you so much for talking to me today.
You're welcome.